Hi, my name is Kelsey. I am the treatment team lead at Advanced Animal Care here in Richmond. A little background on myself. I graduated from Morehead State University. I got my bachelor's degree there. Upon graduating, I came to Advanced and I was a nighttime technician there, and then moved up into day, and now into my role that I currently have, which is the team lead there. I've been with Advanced for about 10 years now. I had to get some hours in before I went to Morehead State for my degree, and started with our founder, Dr. Jim Martin, at our little Waco clinic. Got my hours in there, went to school, graduated, and then came to Advanced in Richmond.
So tell us a little bit about what a day in the life for a Richmond treatment tech kind of looks like.
So we are a 24-hour clinic, so we have both daytime and nighttime positions. The cool thing about us is that where we are a 24-hour emergency hospital, we also have regular daytime hours that we see general practice type of cases. So your dog and cat vaccines, ears, nails, routine surgeries, spays and neuters. And then we also get the part of the emergency side of things. So where our clinic sees patients that we see on the routine if they have emergencies come up, or clinics or clients that we don't see on regular, they can also come to us for emergency types of cases as well.
So what are some job perks that come with being a treatment tech?
So some perks as far as the job itself. So I'm more of the ER side of things. I really like the, come in the door, you don't know what you're getting. Puppies and kitten visits are cute too, but I really like the emergency side of things. And at our clinic, you get to see both. So you get a little bit of GP, and you also get the ER side of things as well. You also get to follow cases through. So if you have a case come in, we can have long dwelling cases that, they're with us for anywhere from 4 to 7 or even longer days in the hospital. So you get to initially start with a case and follow it all the way through, and that's really cool too.
So what is your work-life balance like?
So our clinic is also set up where it is a 24-hour. It is really neat because we do work 12-hour shifts. It's normally 8 to 8, whether you're daytime or nighttime. So typically you can do your 3 days on and you have 4 days off. So a lot of people like that as far as their flexibility in their personal life, as well as getting stuff done on that side of things too.
So what's your favorite part about your job?
Well, there's a lot of different things, but I say the biggest thing for me is kind of like I said earlier. So we have routine cases. So we have our normal clients that come in for yearly exams, that kind of thing. And then we're also there in the event that they have emergencies. So they don't have to go to a referral clinic. They can come to the clinic where they're, familiar with doctors and staff in those events that they have something that they're not, really expecting, and they have a familiar face there to talk to them about these emergency type situations.
So you've been here for 10 years. What has made you stay that long?
Well, the cool thing about Advanced as well, we have 4 different locations. Advanced Richmond is our ER clinic, and that's where I've kind of settled in at. The cool thing about Advanced is that we're a family-owned practice. So I said earlier, Dr. Jim Martin is our founder, and I started with him. I went to school and I came back. And I would say Dr. Martin is a huge part of why I've stayed. He was very good to me. He taught me a lot. Got my foot in the door as far as getting into the program, in college that I needed to be in. And then, it's just continued. It's been a family-owned practice. We're not corporate. So it's a family type atmosphere, and that's what I really stuck with.
So last question, why should someone consider to work for AAC?
So if you are looking for the emergency side of things, there's a lot of different corporates, your MedVets, Metros, VCAs, and I'm not saying corporate is the only, defining factor, but just the comparison of ER clinics. Normally ERs is the only thing that they see. Our clinic gives you a little bit of diversity as far as seeing GP and ER. The scheduling purposes, you can get your 3 days on, 4 days off, daytime, nighttime. We have a lot of new doctors coming in. We have a lot of diversity there. Get to see different practices of different doctors, and then we also have a lot of staff to implement with them as well.
All right, thank you.
Thank you.